Before I began working as a clinical ethicist, I was familiar with bioethics topics. I had taught bioethics to university students, and I had even written some bioethics papers for academic journals. But when I got into clinical ethics, I realized that there are a bunch of ethics issues that come up that healthcare providers see that happen pretty frequently, but that I just didn't really know about as a philosopher doing bioethics. So doing clinical ethics was really important to show me just how many ethics issues are out there that healthcare providers are dealing with that I just wasn't thinking about before. In this video, I want to walk through a case study of a pretty common ethics issue that I get consulted about on a regular basis. This case study is based on an amalgamation of a bunch of different consults that I've seen. Here's the case. Alex is an 82-year-old man in the locked dementia unit of a long-term care facility. Recently, he began having a physical relationship with another resident, Emily, who also has dementia. Both residents have substitute decision makers for medical decisions. Alex is married. His spouse, who lives at home, wants the staff to stop the residents from seeing each other. She's Alex's substitute decision maker. What should the staff do? And so if I were consulted about this, the process would be to talk to the person who has made the request, so the person who calls me to tell me about it, usually a manager or a nurse or someone else at the facility. And I would have some questions. So one of the questions I would ask is, how much do Alex and Emily understand about what they're doing? And let's suppose, to make it more interesting from an ethics perspective, let's suppose that they don't have capacity to make this decision about having sex. That maybe they understand what they're doing, but let's suppose that their dementia is advanced enough that they're not really giving informed consent. The next question is, how do Alex and Emily feel about their relationship? Is there any evidence that either of them are experiencing distress because of it, or they're being harmed, or they're being coerced or manipulated into participating? And these are important questions to ask, but let's suppose that in this case, Alex and Emily both are positive about their relationship. Suppose that they both tell each other on a regular basis, and also tell the staff when asked about it that they get a lot of benefit from it and that they enjoy each other's company. So there's no evidence that either of them are being harmed or that they're feeling any distress. Another question is whether there is some proposal that is being asked of the staff. In this case, there is. Alex's spouse is asking the staff to stop Alex and Emily from seeing each other or from spending time together. So she's asked them to, if Alex and Emily are holding hands or doing anything else, or even just sitting together, she wants them to stop them from doing that. And suppose she also wants the staff to call her whenever Alex and Emily are together. Now, if we were doing a full ethics consult, there would be other steps in terms of fact-finding that we might want to pursue. If we were there in person, we might want to go talk to Alex and Emily themselves. We might want to talk to other staff to see what their perspective is. We might want to talk to Alex's spouse, who is his substitute decision maker, as well as Emily's substitute decision maker, if that were appropriate. I'm going to skip through some of that stuff and go on to the ethics analysis. So there are a bunch of different things to work through. The first one is to say that this is a pretty common situation. This is something that happens in long-term care facilities on a regular basis. One of the reasons is that dementia sometimes causes hypersexuality. So people who otherwise wouldn't have been acting in a sexual way might become more acting in a more sexual way because of their dementia. But it's also just an effect of people. People have sexual needs and preferences, and so sometimes they act on those. That can be uncomfortable for if you are the adult child of, if your mother or father is having sex with somebody else. If you are somebody's spouse, as in Alex's case, that you find out that your husband is sleeping with somebody else, and that would be very distressing. And it can also be distressing for staff who are sometimes uncomfortable just with the idea that elderly people or people with dementia, that they're engaging in sexual acts. So the stress or the kind of concern that people have can come from different places, but it's pretty common for me to get consults of this sort. The first question to think about is whether the substitute decision makers actually have standing to do anything about this situation. And partly I mean this from a legal perspective, so I don't give legal advice, so I would recommend that the requester contacts a health lawyer, which is usually available to them. But also from an ethical perspective it's asking the question about what the scope of decision making is for the substitute decision maker. Now, substitute decision makers are given pretty wide latitude in most jurisdictions. So that includes, it's specifically about healthcare decisions, but that can include where the person lives, as in a locked unit in Alex and Emily's case, what they are eating, are they eating enough, what kind of food, and who they're spending time with. So it is possible, like they do have standing. This isn't something that we would just kind of like reject out of hand about whether the spouse can actually interfere at all or get involved in this. So the next part is thinking about how Alex's substitute decision maker should go about making the decision. And the law in most jurisdictions says that decisions from a substitute decision maker must be based on the patient's wishes or values if known, and the patient's what's in the patient's best interest. So in this case, we might know many things about Alex's preferences, what kind of person he is, what he likes to do, and including his relationship with Emily. And that would be something about his values. There might be things about his past, about what kind of person he was like before he got dementia, that would be relevant here. And so there's kind of a combination of thinking about his values as those are relevant, and also thinking about his best interest. And thinking about best interest, he's clearly benefiting from this relationship. Many people who end up in long-term care facilities, they get lonely and they're isolated, family don't visit them, and that can often lead them to deteriorate faster than they otherwise would. And so in Alex and Emily's cases, they're clearly benefiting from the time that they spend together, and they're benefiting from the relationship overall. So because there's no evidence of distress or harm involved, it's hard to make the case that the best interest standard would advocate for interfering or stopping their relationship. That in fact doing so, even if it were possible, or if it is possible, that could be actually much worse for them. We'd have to split them up. They would be sad or upset about that. And then they might be lonely. They might not have anyone else that they can spend time with or benefit from. Another aspect is thinking about the grounds that Alex's spouse has for asking the staff to interfere. Now, if she had evidence or reason to believe that Alex was being made worse off by his relationship with Emily, then her role as a substitute decision maker would apply. That she can ask, somebody were acting in a distressing way or causing Alex to be distressed, then she could reasonably ask the staff to make sure that Alex was not around that person anymore. But that's not the case for Emily. In the case with Emily, the grounds that the spouse has for interfering seem really just about the spouse's marriage to Alex, that the spouse is upset that Alex is doing this. And to be clear, that's totally understandable. If somebody found out that their spouse was having sex with somebody else, then they would take steps to try to prevent that from happening. It would be really difficult for them to just ignore it and kind of move on or pretend like nothing's happening. So it's understandable that the spouse is making this request. However, that kind of request is not really about healthcare or about Alex's best interest, which is what the role of a substitute decision maker is. So what the spouse is asking the staff at the facility to do is really to stop Alex from cheating, or to prevent him from acting in what the spouse believes to be an unethical way, or in a way that is bothering her. And those are not the sorts of things that healthcare providers or the staff at a long-term care facility, that's not really within their scope. That they're not there to be the ethics police, to stop people from having affairs or to stop people from cheating. And that's even supposing that Alex understands that what he's doing is cheating or being unfaithful in any sort of way. So given that, I don't think Alex's spouse has a strong claim to request of the staff that they interfere with what he's doing. That her main reason for doing that, let's suppose, is that it's bothering her. understandable, but not really within her scope as a substitute decision maker for healthcare decisions. And applying the best interest standard, as I said before, it just doesn't really follow that it's in his best interest to stop his relationship with Emily. On the contrary, I think the evidence that we have is that if we interfered with Alex and Emily's relationship, that would likely be worse for both of them. The last point to consider is consent. It's an uncontroversial belief in society that if somebody is not giving consent when they're having sex, then it's wrong. Something wrong has occurred. But I think this is a sort of case that pushes back against that in a small way as a type of counterexample. So in this case, Alex and Emily aren't being harmed. Neither of them are being taken advantage of. They're both benefiting from it. And so I think it's hard to say that what is happening is wrong or something that should be stopped simply because they're unable to give consent. I think the better way to think about it is the way that we think about decision-making when somebody is unable to give consent. When we think about a young child, the fact that the child can't give consent to something like a vaccination does not mean that it is unethical for us to perform a vaccination or give them a vaccine. Instead, it means that we have to use a different standard. The best interest standard is the typical one. We have to think about what is in the best interest of the individual and make our decision based on that. In Alex and Emily's case, given that neither of them are being harmed, there's not a really strong ethical reason otherwise to interfere with what they're doing. They're both benefiting from it and thinking about the effects of stopping them from having their relationship, that it would likely be quite a bit worse for both of them. And so therefore, I think that this is an important counterexample to the principle that sex always requires consent. I don't think that sex requires consent in this case for it to be ethical. So it's understandable why the response is so typically to try to interfere with this type of behavior. Nevertheless, I think the right thing to do is to take a more sex-positive approach, that it's beneficial for Alex and Emily to continue with their relationship, and none of the reasons that we would usually appeal to justify us in interfering with what they're doing. Therefore, I think that the correct ethical recommendation is to allow Alex and Emily to continue with their relationship. This is my assessment of this type of situation, and you might have questions or you might disagree. If so, leave a comment down below. If there are other case studies that you'd like me to explore, also leave a comment. See you next time.